Welcome, Yamhill County, to Speaking Frankly. I'm your host, Howie Harkema, and our tagline is, "And how we doing?" Today I have a great guest. It's Emily Johnson from the YCCO, who is a community health specialist. Welcome, Emily.
Thank you so much for having me.
Oh,
I really
it's
appreciate
awesome
it.
to have you here. Thank you so much.
Thank you.
We've known each other for quite a while now.
We have, yeah.
So, what is the Yamhill Community Care Organization?
Great question. A lot of people don't know that.
I know.
So we offer Medicaid services to people in this area. That's our main line of business. So it's people in Yamhill County and a couple of people who live in some of the surrounding counties as well. And that means that we are really coordinating the medical care for people who are on Oregon Health Plan in this area. So that looks like, on a service level, helping primary care doctors or, your regular family doctor talk to a therapist who's also going to talk to an oral health or dental health provider. So it's really getting everybody to talk to each other and making sure that care is coordinated in the way that makes the most sense for every one of our members. We also offer some things that are a little outside of what you would think of as traditional healthcare. So we have community health workers who will actually go out into the community. They'll go to people's houses and meet people, go to appointments with them, make sure that they have access to the services that they need, like SNAP or like peer support. So we really go out and try to wrap people in services so that they're as healthy as they can be.
So if you don't have transportation and you need to get to one of your appointments, do you have transportation available?
We do. That's called WellRide, and anybody who is an OHP member and is a YCCO member has access to that service. And so you can call our customer service line or call the WellRide line, and you can get transport to any medical appointment.
Are you a nonprofit?
We are a nonprofit. The cool thing about YCCO is that we're really heavily community-based. Not all CCOs in the state are nonprofits.
Right.
And we really formed locally with our county and local doctors really coming together and saying, we want this CCO to be ours, and we want it to be locally run and governed. So we're a nonprofit, kind of in the more traditional sense of the word, where we really want to give back to our community, and we are members of our community as well. Sure.
A lot of people know you by the term YCCO, and I think that when they hear what the full name is sometimes it's confusing. Do you find that to be true?
Absolutely, yeah. There are a lot of acronyms in this business. And so Yamhill Community Care Organization, the name is really designed to tell people what we do. We're community-based and we offer care. And we also care about people in the community.
And that's what your job is, to care about people in our community.
Exactly, exactly. We're very kind of whole community focused, as much as we, our main line of business is the health plan. We also have two other components. So we do, we're an early learning hub, which means that we coordinate services for kind of all of the early childhood events that are happening throughout the community.
Sure.
So we've got child care at the table, all of our school districts. We bring in DHS and health providers and have lots of conversations about how to make sure our kiddos are really getting the best start as early as possible.
And is Jen still running the early learning hub?
Yeah, so Jen Richter is so wonderful and does a ton of work to really promote early childhood wellness and coordination. And the hub also does a lot of work around trauma-informed care.
Yes.
So we've done events around the community to educate people around trauma and the effects of early childhood trauma on adults, and how to really find places where we can identify resilience and really build that and build a community sense of resilience as well.
Awesome. So when Michelle Bergeron was running the Early Learning Hub, I had her on, and when Jim Rickards was the executive director of the YCCO, I had him on.
Okay.
And so you're our third
YCCO person. Thank you for having me.
So let's talk about the community health assessment and why you need this community information.
Yeah, so as a CCO, we are required to create this community health assessment because Oregon Health Authority recognizes how important it is to hear from your community. So it's really a component of us as a business.
Right.
But it's also really about understanding what our community needs from our community, because we don't want to take a bunch of data, make a bunch of assumptions, and then try to push out services or push out resources where people don't necessarily need or want them. So this is really a chance for us to take all the information that we know about our members. We're a health plan, so we have a lot of it. We know, who's going to the doctor and where and how often and for what reasons, but there's only so far that information can take you.
Right.
So if we have an understanding that maybe diabetes is a problem in the community, we can't necessarily address that unless we understand how the community perceives their own health, how they perceive their own access to healthy foods or activity, or really whether anyone thinks that's a need. Just because we think it's a need doesn't mean that that's necessarily the top priority for everybody else. If you can't get transportation to a grocery store or a gym or even to the doctor, managing your diabetes isn't going to be your main focus. It's going to be figuring out how to get transportation. So that's something that this needs assessment will really help us understand and address.
So do you have bus passes for the busing services as well?
We have some through the Early Learning Hub especially.
Right.
And then WellRide itself will offer bus passes and will actually offer reimbursement for gas. So a lot of people don't know that.
That's important.
It is. You can get a ride, but also if people want to take their own car but need to get up to Portland for a specialist appointment, that's something that we can actually reimburse for. So WellRide is a really great service, but it's also something that is only for medical appointments and it's only for OHP members. And so this needs assessment helps us determine where that need is, maybe for people who don't have OHP.
So are all of your members Oregon Health Plan members?
Yes, yeah. Not everybody in this area is necessarily a YCCO member if they're an Oregon Health Plan member. There are some who are on open card, which means it just means that we don't manage their care. But yeah, everyone who is our member is on Oregon Health Plan.
So when I turned 65, I had Oregon Health Plan through the YCCO, and then it transferred over to Medicare. And I went to the senior Northwest Senior and Disabilities, and they take care of my Medicare.
Yeah, when I first moved here, I had OHP, and it's maybe the best health coverage I've had.
Yeah, me too. So how does the YCCO define community?
Yeah, good question. So we define our service area as the people we serve in this county and then some of the surrounding counties. That's where our members are. For the purposes of this assessment, we define community as where people live, work, and play. So if somebody works in Yamhill County but maybe resides outside of this county, we still consider them a member of this community.
So Grand Ronde would be considered part of this community?
Yeah, or Willamina, where you're split between counties. I would consider anyone in Willamina a member of this community.
Awesome. So how did you derive the questions on the health assessment, and who were some of the helpers and players involved?
Yeah, we took a long time vetting
I
this
bet.
survey. We have a community advisory council. So that's a council that we are required to have, but also that we really enjoy having. It needs to be at least 50% OHP members, so our members, which it is, and they come to meetings every month, and they're so gracious to spend time with me and talk through a lot of things like this. So we did a couple of processes looking at the kinds of data that we can get and asking that group, what are some other pieces of information that we don't have that we want to know?
Sure.
A lot of the questions we were asking were around, how can you tell the story behind the data that we have? If you know that opioids are a problem, that's great. We have some numbers and percentages that say that, but what's the story behind that? What is the experience of people in that community?
Sure.
And so our Community Advisory Council was really instrumental in helping to ask those questions and really uncover those stories. We ran it by a couple of our committees. I sent it to some individuals that I trust. We ran it through just a lot of different groups to really figure out where the gaps are in the knowledge that we have. There have been a lot of community health assessments done recently.
Yes.
Yeah, public health has been a wonderful partner to us, and Providence Hospital as well has done a recent one, and
Right.
they've both been incredibly cooperative, and we really want to kind of share information the
Right.
best that we can and also not overlap. So the questions were developed with that in mind, that we're not trying to reinvent the wheel. We want to fill in gaps in knowledge that haven't yet been answered by some of these other assessments. The last thing about this survey is that it has a lot of demographic questions.
Yes.
So people tend to be kind of unwilling to answer those sometimes. It's a very anonymous survey, so none of those things are tied to individuals, but that's something that helps us understand disparities. So if someone of a certain ethnicity or someone who lives in a certain part of the county is experiencing their health care or is perceiving their level of health or the different kinds of needs in different ways, that's something that we want to know. So we can look at some disparities with the data that we have, but by filling out the demographics, you know, your gender, where you live, your sexual orientation, all of those things can really play into health in really profound ways.
Right.
So the demographic questions take up a chunk of the survey, but in a lot of ways they're the most important, so we can understand exactly where to target the help and what populations really need things most and maybe what populations don't.
So I recently took this assessment, and it took about 15 minutes to get through it all.
Yeah.
But there is an incentive at the end page, so would you like to talk about that?
Yeah, absolutely. So we're able to offer a $75 gift card. We're offering it for a couple of sort of basic places, Safeway, Winco, Fred Meyer. We want to make sure that it's really helpful and fairly accessible for people anywhere in the community.
Sure.
But we're also giving people options. So honestly, if someone wanted a $75 Dutch Bros gift certificate, I think that that is in our list of options.
That's what I would want.
Me too.
Who do you want to give information on this survey, and is it only for OHP patients?
Yeah. It's not only for OHP members. We want anyone and everyone of any age who lives, works, and plays in this community. So I really am defining community, or letting people define community in the ways that they want. If they feel strong ties to Yamhill County and those little areas surrounding it, they're a member of our community, and I want them to complete it.
It's really important that you get a really good demographic of.
Yes.
Yes.
Absolutely. We have fewer responses than we would like, so we really encourage people to fill this out and make sure that their voices are heard.
Right. So once the information from the surveys are gathered, what will you do with the information?
Yeah. The survey closes on March 8th, so we have a tight turnaround time and we want to get just as many responses as we can. Once we've gotten as many responses as we can, we're going to take all of that information and ask a lot of questions. So we'll do some work to divide things into demographics based on those questions. So are people who live in a certain zip code perceiving that their health needs are mostly childcare, whereas people in different zip codes are saying their needs are more around transportation? So we're going to do a lot of slicing and dicing of that data and then displaying it in a way that makes sense and offers a relevant narrative to this community. The other thing that we'll do is compare it to the other information we have. So if we're saying that we know that our members are, again, maybe struggling with diabetes, but the survey responses are saying something different, we'll do some work to compare those and figure out maybe where we can help answer those questions or find the why of that information. And that'll be supplemented by focus groups. We're having those all around the county as well. We're kind of trying to access as many groups as we can. And so we'll supplement comparing the survey data to other data that we have that might be national and local and specific to our members with those survey and focus group narratives. So with all of that, we take it and we put it in a big long document called the Community Health Assessment. And that document is really going to tell the story of our community as it is right now, or maybe from 2017, depending on when we can get our data.
Yeah.
And then that document is really going to be the basis for developing a community health improvement plan. So that's something that is going to guide our work for the next 3 to 5 years.
Right.
And is something that our Community Advisory Council is going to be pretty much entirely responsible for. So we're identifying strategies that address the needs that the community itself has identified. And we're going to align those strategies with our own strategic plan as well as Public Health's community health improvement plan and Providence's plan and other plans that we see in the community. We don't want to overlap and we don't want to be redundant, and so this plan is going to be our own in that it's informed by the information that we have, but also very collaborative with the rest of the community.
Which is really important.
Yeah.
So I have a couple questions regarding that. So if you see a certain question that was answered in 2017 and it's the ratios have changed now, how do you factor those two things? If you see like 20% answered this question back then and now it's 80%.
Yeah, I'm very curious to see that change. We have a couple questions on the survey that were asked when we did it back in 2014.
Right.
And they're questions about priorities and about access to care. And in 2014, YCCO was still very new.
Very, very new.
Yeah, the ACA expansion was very new. And I think the needs look a lot different now than they do then.
Right.
So we'll be able to compare those things and really see over time where we've been able to expand and meet needs that we weren't meeting before, and maybe how those needs have changed and grown in some ways as this community has grown as well.
Right. And it's really important to be collaborative because as a nonprofit and as you request for grant money, you have to prove that you have collaborative nature.
Absolutely.
So that's really important.
Yeah.
So hearing from this community about the true needs is really important to the YCCO. Why not just assume what is needed?
Great question. You can't make
a lot of nonprofits do this.
I think especially as nonprofits and as service agencies, we are working so much with our population and with data and with groups of people kind of on the ground trying to understand their needs, and we create narratives for ourselves about where the greatest need is, and we don't always ask people who are just living in the community. And so if we make assumptions, I think we can be accurate about what some of the objective needs are.
Sure.
But we're not really connecting with the people we serve. And I'm a member of this community, and being able to connect with people about what they think they need
Right.
is the best way to actually meet both their perceived needs and some of those real needs that we see in the data.
Right. So where can they take this survey? Can they do it online? Are there paper copies, and where can they get those?
Yeah, you can take it online. There's a short bit link that you can enter, bit.ly/healthyyamhill. It'll get you to a SurveyMonkey, which is in English, and then there's a link to a Spanish one. If people want it in other languages, we can provide that. So that's the online survey. We've been handing out flyers and little cards with that link on it. We'd love for people to take it online because it's easiest for us.
Sure, because you derive the information right then.
Right, exactly. We do also have paper copies. I have 3 wonderful interns from Linfield who have been delivering paper copies and posters and cards all around the county, and we can deliver paper copies if anybody needs them.
So on the electronic version, is it form fields where you just fill in the information?
Yep.
And I know it's anonymous. You're not asking who the person filling it out is.
Right.
You're asking if it's male, female, and that's about it.
Yep, so we ask the demographic questions that are pretty detailed, and then in the online version there's a separate link, so you have to finish the survey and then you're given a link to a completely separate survey where you can enter to win the raffle. So all that information is kept completely separate. We wouldn't even be able to match it if we tried. And then with the paper survey, we have a separate sheet of paper. Everything is submitted separately.
Awesome.
Yep.
But there are posters and flyers and information around the community
Yeah.
throughout all the townships
Yep.
in Yamhill County.
Yeah.
That's awesome.
Yeah.
And how did you find these Linfield students to do this work?
Oh my gosh. So Public Health actually has a really good partnership with Linfield, and they're able to offer credit for those internships.
Oh.
Yeah, so it feels very symbiotic, and they've just been wonderful and really hardworking.
I'm sure they are.
Yeah.
So I only have one other question for you, but you have quite a bit of time here to answer it. Why do you do this important work for this community?
I, first of all, love this community. I'm originally from the Midwest, and I find so much of that kind of Midwestern friendliness here,
Yes.
and that desire to take care of one another. In a lot of the focus groups I've been doing, that's the thing that rises to the surface. People really genuinely want to network and take care of one another and build everybody up. That's something that I've not seen anywhere else I've lived, and I really love it in this area. I do the work that I do because I think that serving needs that are happening right now, treating symptoms, that's what a health plan does, and I find that incredibly important. Healthcare and healthcare reform is one of my big personal soapboxes. And so I think that being able to treat people's needs and improve care for people is completely pivotal to improving lives. That said, I think our organization especially is also focused on prevention and community wellness, and I love working for a kind of community-based nonprofit that thinks about those upstream interventions as well. The work that we do with early learning and the Early Learning Hub is the kind of work that I think is going to make people healthier 10 or 20 years from now, and when other communities are maybe struggling with a lot of the health issues that prevention would have prevented, we're kind of ahead of the game in starting to understand investing in new families and, you know, even people before they're having babies, and, in babies and early childhood and school interventions, all of those things are really tied into health. And so being able to acknowledge those social determinants, being able to acknowledge health equity and how disparities can really impact people in incredibly profound ways.
Yes.
That's really kind of where the real work is.
Yes.
And so I'm so lucky to be in this situation where we can see, you know, our community health workers impact somebody's life right now and get them into really good primary care, but then also see how our prevention can impact things 10 or 20 years down the line.
Wow. So, number one, I agree with you about this community. It's very passionate and very compassionate to do the next right thing.
Absolutely.
And there's so many nonprofits and city government and county government all working together to make things happen for the betterment of all of us.
Yeah, we have amazing partners.
Yes, it's an incredible situation. And I've only lived here for 12 years. I grew up in Newburgh. So when I came here 12 years ago, that was one of the first things that I started seeing was how passionate people really are and how they want to play together well.
Yeah.
Because that doesn't always happen in communities.
That's true.
And so we're so lucky. And we're so blessed to have people like you that are doing this work because they love the work. And it's a challenge, I'm sure, but it's got to be fulfilling.
Yeah, it is. Yeah, we're lucky to have people like you too, Howie.
So the YCCO, go online if you want to do the survey online. There will be a link there. If you don't see it and you don't have a computer or something, you can get a paper copy. And I assume that you even can get it at your office if you can't find it.
Yeah, you can call me or email me and I will get you a copy if you need one.
So very good. So Emily, thank you so much.
Thank you,
And thanks
Howie.
Seamus for letting you be on today.
Absolutely.
So if you want to get in touch with me and you've got an idea for an upcoming show, you can email me at howieharkema@comcast.net. Or if you want to watch a previous show, it goes to my YouTube channel, which is the Howie Harkema channel. So you can watch any past episodes anytime you want. I also link it to my Facebook page so a greater audience can view it as well. So thank you very much for watching today.